problems, problems, problems. Empathy is never a positive thing in their terms, which I think I often consider that too. I rarely consider a positive empathic response of understanding somebody's joy. So that was something I found to be interesting. Most often people say that empathy is missing in their work. They want their bosses to be more understanding. They want their coworkers to be more understanding. And they believe that they should be more understanding to their employees, to their coworkers. And I thought that was interesting because all these people have completely different jobs. You know, one of them works, or a couple of them do manual labor. There are a couple of teachers, different people working in office settings, business world. So although there's a lot of differences in the work environment, they all find a lack of empathy at work.
I guess some of my unempathic experiences were a little traumatic for me. They were earlier experiences in which I wasn't empathic. So I think from then on, you know, those experiences really pushed me in the opposite direction. So my empathy is, in a way, kind of a reaction formation in response to my lack of empathy. But it's more than that. It was a philosophical and, you know, almost kind of spiritual feeling of guilt, and you want to repent from it and grow from it. So I would say my empathy, to the extent that I do have it, has its basis in earlier kind of traumatic experiences, psychological.
Where to draw the line?
So I don't think that being empathic means solving the other person's problem. I think that it means listening, actively listening to what they're having to say, and just being someone for them to lean on. So it doesn't mean you have to have the answers for them, or that you have to provide them with whatever the solutions may be. It's just that you're there for them. And sometimes that's what people need, is just a listening ear. And in fact, it's not even that you have to say, well, here's how you can fix this. It's asking questions. Oftentimes people already know the answers. They already know what they need to do. It's just getting them to say it, right? So I don't think that we need to be solving all the problems, but just being there, genuinely being there, and listening to them and supporting them. I think that's what empathy is, and that's how we avoid kind of taking it too far.
All right, so in the 1930s, what happens is this guy's trying to quit drinking through the Oxford group, and it's a Christian group. He has no success on it at all. So what he does is he's jonesing at a hotel in Akron, Ohio. He decides to call a clergy member. A clergy member refers him to this doctor, Dr. Bob Wilson, who's a medical doctor who's a complete drunk. And he calls him just out of a whim and decides, hey, can I just talk to you? I just need someone to talk to. He goes over there, thinks he's going to spend 10 minutes. Dr. Wilson's like, this guy's a clown. They end up spending 3 hours. It was the empathic nature that they had with each other that formed AA. So again, that's the key foundation, is you've got to work with other people to stay sober yourself. You got to give it away in order to keep it. And so it's all about empathy. The whole program is empathy.
Well, empathy to me has two parts. As I mentioned before, empathy to me is an organic self-awareness, which of both weaknesses and strengths, but especially of limitations. And then coupled with that, as a synergy, you have intersubjectivity, where you then view the other as oneself, and you realize that although they might be different in some ways, and come from a different cultural background, have a different psychological pattern of thinking, which leads to, of course, different pattern of behavior, nevertheless, they are a human being. And I think it's within that definition of organic empathy that we can see the oneness of humanity, in my opinion.
There was research recently done on empathy in children, and children who are involved in music tend to show greater levels of empathy. And so they're assuming it's something to do with how it incorporates the whole brain and understanding that piece. But the results were actually kind of surprising. And it's interesting because in schools, the arts and music tend to be one of the first things cut from programming. And, you know, are we starting to see some of that effect later on down the road, where kids haven't been involved in activities that are able to increase their level of empathy and understanding other people and having those feelings for other people. And one person actually specifically noted that empathy is most missing on Black Friday, which I've also actually observed myself. I will never go out shopping on Black Friday because I worked in retail, and I know it's almost like it brings out the evil in people. It's not fun.
Take the perspective of another, and as a behaviorist, we're very into defining things. We would say that I'm able to take your perspective when I'm able to describe what the world looks like to you, when I'm able to make predictions about your behavior, you know, based on my knowledge of what you're dealing with and in your environment and your life. Mm-hmm. That would be perspective taking. And you know, like, my perspective taking skills are such that I know if I threw something at you right now, you'd probably put your hands up, right? That's right. Okay. Kids with autism, people with autism generally have deficits in perspective taking abilities, and being able to predict the behavior of another. So one thing we do one of the interventions that behaviorally we target to work on that particular deficit are perspective taking training. Mm-hmm. And it's right now that's actually one area of research for me, is looking at ways that we can more effectively train perspective taking. Right now the best technology we have are to play kind of funny looking games, like I'm sitting here in a sweater, you're sitting there in a jacket. If I were you and you were me and here we're there and there we're here, what would I be wearing?
I see.
What would you be wearing?
I see.
Right?
Yes.
And presenting children with different trials of this type, simple to complex. The one I just said is a pretty complex one.
Another person said empathy is lacking in neuropsychology when we see a patient as a disease and not as a person. An interesting scenario where if we're talking about cases, and we do group supervision where we bring up interesting cases in the week and we kind of go through them. It's interesting because we see it as the diagnosis and we're not really seeing it as the person. For instance, we had a case that was on Capgras syndrome. Capgras is where people are unable to recognize a familiar person and they see them as an imposter. So instead of really kind of empathizing and seeing how difficult that may be for the patient themselves, we're more sitting there saying like, oh, this is so cool. Like, what did they say? What did they do? How does this relate? How does this relate? And I think that's another part where it's hard sometimes to see the patient as a person and really be with them. And we see it almost as like a medical student would, where it's something just interesting and fascinating.
I have a client who has come a long way since we started, and he came in yesterday and was just really happy because he stood up to his parents and he's standing up to people and he's saying no, and so my empathic response was kind of like, you're really excited and really proud, like happy with yourself that you were able to do this type of thing. And then I added some judgments in there because I was all like, I'm so excited and happy. But yeah.
You could look at empathy as kind of a scientific fact. The neuroscientists definitely like to do that, and the evolutionary psychologists and people like that like to do it as well. But what they do when they do that is they kind of reduce empathy to something else, unfortunately, rather than really appreciating the phenomena of empathy in itself.
Say more about that. What gets reduced to what?
It gets reduced to certain brain areas and certain neurotransmitters, or it's reduced to a kind of strategy of survival, community, and procreation and stuff like that. But it's really, and I understand that reasoning, but it's a little ridiculous to really think about empathy in those terms when you compare it to our experience of empathy. You know, what it means for us as we move through life.
Yeah.
You can't reduce. Sometimes it's a little difficult to get out of the zone.
Yeah.
I find myself getting very affected by sitting with another person. It's difficult to at times. That's why it's important to have a community to reach out to.
Right.
Not you'd be surprised. Well, maybe you wouldn't be surprised to learn, but in the world of mental health,
Sure.
sometimes there's not a community to reach out to. You would think there always is for clinicians.
Yeah.
Sometimes there's not. And to hear about the stories that these clinicians tell, I'm thinking of the ones in the military.
Sure.
That's very difficult for me to hear.
Yeah.
I'm very sad to hear that for the clinicians.
Yeah.
And there's certain forms of psychotherapy that I think would be very helpful. I think acceptance and commitment therapy, which is
Acceptance and commitment, key term.
acceptance and commitment, which is not trying to rationalize away what these individuals did, which may be how some older forms of cognitive therapy would approach it.
Okay.
But learning how to actually sit with it, come to terms with it, and still live a productive life in accordance with your values. I think that might be promising. That's a very difficult one. The equation of kind of social success and happiness with being a good person. That's what one of the things it boils down to. That's very difficult and problematic. It's difficult to really see empathy coming from the culture at large when it has those kinds of core values. So maybe people really need to learn how to find it on their own terms.
Mentally, I have a lot of trouble with empathy, and yet I think you're right that much of the focus of my work has been to sort of create an empathic stance towards those, particularly those who are most unlovable and discarded and marginalized. I'm working on a book now based on 20 years as an expert witness in murder trials. I certainly find as a psychological expert witness to do the best I can in that role, that getting emotionally close to the killers is essential, at least as an instrument, as a vehicle.
A method of research.
A method of research that it doesn't overwhelm and flood me in the way that it would a lot of people. So sort of ironically, I can establish this empathic stance towards them because my sort of constitution, if you will, is not particularly naturally, temperamentally empathic.
And I remember the conversation was around what's the difference between empathy and sympathy. Because there seems to be some confusion at times when people are first learning about it. So empathy was kind of the big discussion of the day, and it was talking about how it's being able to relate to others' feelings. So not necessarily that you can feel exactly what they're feeling, but that you can relate to what it is. You would be feeling almost, hopefully I'm explaining it correctly, but almost feeling sad for someone or feeling. It's usually associated with someone going through a tough time, and you feeling for them. Whereas empathy is more being able to relate to what it is. If I can kind of turn that off and go back to my life and focus on my life, then you're right, it's going to consume me. And so I don't know that there's some formula that you need to employ empathy this much and then turn it off.
And so fast forward all of these years, and here you are,
in
the role of a job coach.
Yep.
And I mean, how does empathy play, if it does? in your day job.
It
In your
does.
role, in your role.
Yeah, yeah. It does. So in my role, I coach people on a daily basis. I teach courses on a daily basis of job search.
Yeah.
And so I think what it takes to be a good career coach is to be able to relate to what the person in the chair that you're talking to is going through.
Yeah.
So whether it's because you've been through the same experiences or because you can just emotionally relate to some of the troubling times that they're going through and frankly some of the exciting times that they're having too. And to be able to celebrate those successes and to help them through some of the more difficult times too. I think if you don't have empathy and you're not empathic, you're not going to be good at this role. So I think that you kind of naturally have to have that. I do think that empathy is something that you naturally either have a tendency for or don't. Mm-hmm. But I think we all can be reminded of it on a regular basis and can even be taught it to some extent. I think that life is so fast-paced.
Yeah.
And we're in such an independent society that we tend to think about us as number one.
Yeah.
Where when we can be reminded, hey, we're all in this together, I think that so we can all be reminded of empathy. But I think naturally you kind of have it or maybe I think part of what they need to think about is they may interview 20 candidates for one position. And only one of those candidates is going to get that position. But those other 19 people could be their customers in the future or currently, right? So that could be part of their business. So how they're treating those interviewers or candidates throughout the process really has an impact on their bigger business, their brand, their reputation. Because as we know, bad news or negative comments spreads quickly, right? So if a candidate is treated poorly throughout an interview process, that's going to spread quickly. So I think that's one thing to think about. But in terms of getting the right person in the role, I think that they need to stop treating candidates as this, checklist, as we've already talked about, and instead really talk to the person. Just have a conversation and take the time and really be present during the interview. I think so many times the interviewers are thinking, okay, I have to meet with 5 more people today, let's get through this. And instead of really being present in the conversation.
So be fully present. Empathy would enable an employer to be fully present.
Yes.
And that might not be a bad definition of what it's about, actually.
Yeah. Interesting how that comes about.
Went to an open meeting of Alcoholics Anonymous on Friday night. It's a big one. First, let me define open. Open is a meeting. An open meeting is not, the requirement doesn't have to be, you don't have to be there to have a desire to stop drinking. It's open to family, clergy, practitioners, whoever wants to go, whoever wants to get more information on AA. So I had to go to that one simply because there was going to be a lot of people there. So I just need to put that out there that I can't assume that everyone interviewed was in a self-help group. A lot of people term it as a self-help group, but it's really not. It's a mutual help group. Everyone there is to help each other. So that brings up the interesting concept of empathy, because they always say the most important person at a meeting is the newcomer. And why is that? The newcomer is the person that's struggling, that probably, like I've never seen anyone, being a licensed alcohol and drug counselor, I've never seen anyone come into treatment or to their first AA meeting when life was going well. You know what I mean? Stuff's going on, usually not good stuff. So the empathic nature of the people in the meeting, if you see somebody new that you haven't seen, that they get up and say hello, extend their hand, just have an overall affect of other examples where empathy is missing in your experience, life, or world. 6 people said that empathy is missing when they work with, here's an interesting one. 6 people, which is interesting, they said that when they're working with people who keep drinking and are not taking or following suggestions with people that have long-term sobriety, they said their empathy is missing when dealing with those people. 9 others stated with their family members and loved ones. So let me talk about that one a little bit. It's interesting because the whole point of, there's 12 steps in Alcoholics Anonymous. The 12th step is basically working with other people. So in order to do that, you really need to have an empathic nature. Now, I can imagine you can get quite frustrated with people that continually go out and relapse or continue to drink when they've been shown a new way to live and they're not following suggestions. Again, those 12 steps are considered suggestions, but it's the same type of suggestion as I suggest you pull your ripcord when you jump out of an airplane, on your parachute. It's pretty
Here's the
interesting.
evolution.
What do you understand by empathy? 60% of people, understood empathy to be the ability to walk in one's shoes while attempting to see life through that person's lens. Now, I paraphrase that to mean that, but that's overall what they were saying. To walk in one's shoes, to see somebody, to see what that way they see life. Several other people understood empathy to mean to feel sorry for. Wrong answer, but I wrote it down. Here's one of the right. Here's what one person said, which I found pretty interesting, and I quoted this because I wrote it down. For an unparalleled understanding of how a person navigates through his or her world, it's an ability to see what they see, feel what they feel, and interpret how they interpret. Interesting answer.
Situations like dementia, where people are so isolated, pulling that music piece in is that other therapist in the room to help strengthen that empathy is really important. You can see it over and over in videos and working with people who have dementia, Alzheimer's, maybe suffered from TBIs.
I'd be happy to incorporate some of my own experiences that I've already been through, that I've processed, but I don't know that it would be healthy for me on a daily basis, because I do try to employ empathy whenever I work with someone, to take on 100% what they're going through. I'd like to be able to understand it, be a part of it. So I love what you said when you said be present, and then it takes therapy to the next level. I totally agree with that. But I just would be concerned about not only taking on their pain for burnout for me, but also that maybe my patient would feel badly about making me feel a pain, have that extra burden onto them. They've probably already felt, like, I don't know, I just always go back to Alcoholics and Addicts. They know that they've effed up and they've really hurt a lot of people. And to now see that, they're hurting somebody else, I don't know, that's just my thought on that. But I think it was a great job. It gave me a lot to think about.
I guess as therapists we have to be careful that we aren't necessarily taking on their pain. We're with them in the moment, but we need to know for ourselves how to definitely
Compartmentalize?
Yeah, and not necessarily be in that space once we need to be present right then, but we don't necessarily need to, and it's going to be different levels. I think there are some patients in some situations that are probably going to connect with us, we're going to connect with deeper. And I think there's some that we're not going to necessarily connect with in that same level, but we can still empathize with. I think, and maybe that's where there's that difference between sympathizing and empathizing. I'm not sure. It's a hard piece to. Yeah, and you're right. It is a hard thing, because I think there are times we get overwhelmed with our emotions with things, with clients, and I don't know. And I think sometimes it's okay for them to know that that we do feel what they feel, and so that their pain is real, and so we're making it. I remember very well a cancer patient I was working with, and she was dying, and she was in the hospital, and there was a song she wanted me to sing, and it's a powerful song in its own right, but we're going through it, and I sing it with her, and then we're talking about what that meant for her in the situation, and she just started bawling, and it was very difficult for me not to be in that space of wanting to cry with her, because I could feel where she was at, and I think it was okay to feel with her at that moment, because she was at a really hard space in her life, and I don't know, but yeah, you're right. We have to be careful not to be too much in that space with them where we're feeling. We still need to kind of be holding them in that moment, not them holding us. So I guess it's being.
Empathy is organic. I don't believe it's something that it can be information from an external source. It can be something from the environment. It can be something from the culture. But I think that empathy really has as its basis an intuitive or instinctive foundation within the person. Now, granted, there are always exceptions. I think there are people who don't have a feeling of empathy that comes natural, and those would be the people that we would say don't have a conscience. People whom, say, to use an extreme example, a Mao or a Stalin or a Hitler. Someone who can compartmentalize what to do to human beings and the consequences thereof. And they can't really be intersubjective. They can't really put themselves in someone else's place and be intersympathetic. So there's always an exception. And again, I think that the empirical materialist is in the same vein. The person who denies religion as being organic, and only sees it as organization, like say Nietzsche, who would argue that religion stems from a concept which is built upon or resulting in organization, and the organization therefore corrupts individuals, and the organization itself is corrupt, rather than an individual spiritual feeling or emotive intelligence, which then informs from within. Empathy to me is something that is very organic. It is deep within the person. It informs the person about ethics. It is, I believe, an inherited characteristic. If you want to call it part of the gene pool or maybe a mem within consciousness, I think very much so. Again, as we go through life and we have our experiences, like Max Scheler would say, we have the exposure to the qualities of objects, the qualities of subjects, the qualities of concepts, and we derive values from them, depending upon our personal characteristics, in whatever way, shape, or form we've inherited. And then over time, the more experiences we have, the more we absorb these values, make these choices, and then it becomes a hierarchy of values, and then a preference for those values. And I think empathy, Max Scheler believed very much so in an emotive intelligence which resided within each person. He never used the word the heart specifically, but that's sort of what he meant, that the heart as an abstraction has its own intuitive, instinctual sense of what is right and what is wrong. Unlike Immanuel Kant, who would say, well, we have to rationally agree on a fundamental principle by which we can derive ethics from, right? Max Scheler would say, no, that's nonsense. We derive our sense of empathy and our subjectivity through something that's instinctively organic. The person who's without the empathy that you and I are trying to refer to as a concept, as an organic concept, and a manifestation of something that's intuitive, they're always in danger of destroying themselves, because the less empathy a person has, the more opportunist they become. And that leads to hubris, leads to narcissism, that leads to self. A person who lacks empathy is that when you get into that kind of narcissistic cycle, you end up taking your absolute subjectivism and you impose it, or you try to impose it, upon the world around you. In other words, the reality that you prefer through your own preference of values, you impose it upon the world. You can get away with that to a certain extent. But of course, the more you live and the more you're exposed, the more the contradictions become more and more apparent. And you'll eventually trip yourself up, because you're projecting your own egoism and your own absolute subjectivity onto a reality which doesn't conform to it. Is proven through neuroscience and other means. If empathy is proven to be organic, then despite the fact that there are exceptions, we can still link and connect intersubjectively throughout the world with different cultures. And it's that anchor of organic empathy that will lead to a compelling reason for humanitarian intervention, which is contemptuous of national self-interest and power politics. Because one has to ask oneself, how do we compel nations which have the resources, have the supplies, and have the capabilities to rescue people and help other countries in terms of natural disasters, in terms of conflicts, in terms of warfare, in terms of disease, famine? How are they compelled to act? Well, they can't be compelled to act except through use of force if ethics is, national self-interest, if ethics is nothing but an intellectual concept. So it has to be founded in something that is organic. So therefore, it is automatically compelling.
Yeah.
So that if you were to deny acting, then there's a sense of ethical illegality about it.
Consistent one was to feel for others. So, as we've discussed before, people believe that empathy is much more of a feeling thing than it is of an understanding thing. And I think really the confusion with sympathy continues. And I think that has always existed. And a lot of people, when talking to them, would say, it's like sympathy, right? And I'd say, if that's what you say, then sure, yeah, okay. I'm going with judged. That empathy is often means that somebody's listening to them and hearing them and doing so in a way that they're not making. The most common answer was that somebody is living life with them. They are living alongside of them. They are hurting with them when they hurt, and they are joyful with them when they're joyful. So I think that was actually, interestingly enough, when all the answers come in about what does empathy mean to somebody, it's to feel for others. And then when I say how is it present in your small group, it's to live with others. And I think when you do live life with somebody, that means you kind of have an understanding of what they're going through. And that you are identifying with them, with their feelings, thoughts, and their attitudes. So that actually seems like a much more appropriate and correct definition of empathy. If that's what they had said as their answer to empathy, then it would have been like, wow, you kind of know what you're talking about. But it's interesting that somehow they work their way there, who will immediately begin crying if you are sad, and if you're happy, she will jump up and down and be happier than you are. And to me, that was interesting because it's more about the expression of it then. Whereas empathy is, I think, more of an understanding, regardless of how you express it. Do you understand it? And then going beyond that is an issue of your reaction to being empathic. Because you can be empathic, and like somebody mentioned before, you can be a bully and be empathic. You can understand what somebody's going through and then use it to manipulate them more. Or you can understand what somebody's going through and sympathize with them and share with them. So I think that kind of illustrates the way that oftentimes people confuse the two, empathy and sympathy, because it's not necessarily about jumping up and down for joy when somebody's happy or crying when they're sad, because that is I think the definition of sympathy. And then it was interesting because this person told me that I'm not very empathic. And I said, well, because I don't express my emotions. That's what it came down to, So that made for kind of an interesting discussion on what empathy means to him and what empathy means to me.
So, I mean, really what it is it's a lot of behavioral characteristics,
Yes.
one of which happens to be inability, deficits in perspective taking, right? Which I don't know if perspective taking is empathy. However, I would think it's probably one of the component skills of empathy.
As I kind of got answers all over the place, I really wanted to give a definition, and so this is what I got from this is from A Way of Being by Carl Rogers, and he says, when someone really hears you without passing judgment on you, without taking responsibility for you, without trying to mold you, it feels damn good. When I have been listened to, when I have been heard, I am able to perceive my world in a new way and go on. It is astonishing how elements that seem insoluble become soluble when someone listens. How confusions that seem immediate become relatively irremediable become relatively clear, flowing streams when one is heard. So I think that really is more my definition of empathy and how it can be helpful versus some of these other definitions. And then
interacting
okay.
with the other person. It's sitting there for a long period of time
Yeah.
with the other person. It's the other person giving you cues to let you know that, you know,
Yeah.
they're being heard. So all those things put together.
Yeah.
But yeah, it can be difficult to know where that limit is. You don't want to break down and cry in front of a patient, in front of a client.
Right.
That could be counterproductive.
Could be.
At the same time, if real emotion
Yeah.
does not come out, then you're not activating the client properly in the context of the therapeutic relationship. That's where psychology and psychotherapy really needs to step up, and maybe the culture needs to open up to it at the same time. I don't think there's any other way to solve that. I don't think you could. There's actually great community kinds of things. There's an ex-SEAL. I forget his name, but he's fantastic. And what he does is he has these vets volunteer.
Yes.
And still continue the mission.
Yes.
The mission continues. I think that's what it's called.
The mission can very nice.
The mission continues. I think that is a fantastic thing he's doing. But I think medications are only so useful. So I think the culture at large needs to open up more to psychology.
Yeah.
And PTSD, everything that the vets struggle with.
Yeah.
They really need to educate themselves more.
Yeah.
And at the same time, we need to step up too, as clinicians, as mental health
Yeah.
professionals. So there needs to be a lot of societal.
Yeah, I feel.
Go ahead.
No, I feel like we're just getting warmed up here, Adam.
Yeah.
And we've now got into some really rich material.
I agree.
Age. I'll give you an example, I think, where empathy really played a role. I was testifying once in a case where a guy had been tried and convicted about 8 years early, been on death row for 8 years and got a new trial. I went to testify, I was waiting outside the courtroom. And waiting there is a guy who's a prison guard. And we got to talking. He's a prison guard on death row. And he said, when I first took the job, I was sort of your classic, Fry the Bastards, white, rural, all the caricatures that would fly. He said, but working on death row for 8 years, I've gotten to know this guy today, and I've come to understand his humanity and what he suffered through, and so I'm taking my day off to drive 3 hours to come testify on behalf of sparing his life. So to me, that was sort of a breakthrough of empathy. That all the social categories kept him disconnected, but the actual experience produced an empathic response up to his life. That, in a sense, when you go to prison for life or for these decades, you're really faced with a decision to either be a monk or a savage.
I see.
And it's a whole question of why some choose to be a monk and why some choose to be a savage. But the ones who choose to be monks, often they engage in a process of education and spiritual development and reflection, and they sort of pull themselves up with their psychological bootstraps.
Yeah.
Now, I have interviewed guys who I think were psychopathic.
Yeah.
A guy who he and his friend just want to know what it would be like to feel like to kill somebody.
Yeah.
So they called a pizza delivery place and had a pizza delivered to a illusionary address. They were waiting with guns and they shot the guy in the truck just to see what it would be like. Now that indicates a level of sort of moral damage as well as psychological. I don't know where that person's going to go.
Did you have an opportunity to make a recommendation in that case? I mean, I'm just curious.
Well, that was a death penalty. Life in prison with the possibility of parole creates the grounds to motivate. If there can be change, it motivates change. And the recognition that human beings are dynamic and fluid and not fixed. And even the research on brain development, the malleability of the adult brain, is good news in the sense that if you put yourself in rehabilitative settings, you can reorganize the way you work. And of course, most prisons don't offer a lot of opportunities for that. But I think we sort of owe it to these guys to at least give it a look. I've come to think of most of these guys as untreated, traumatized children inhabiting the body of scary men.
Yes.
And I was using that phrase once in a talk, and a guy came up who had been falsely imprisoned for 20 years for murder he didn't commit and then released. And he came up after he said, I spent 20 years with these guys, and that's exactly what most of them are. And that to me speaks to the justice of why it's fair to try to establish an empathic relationship with them so that you can appreciate that their monstrous exterior maybe sort of masking and protecting a very fragile. Here's a guy interviewed this really scary social concept that transforms empathy into an engine for social change. Is what other people call this, what I refer to as the circle of caring. The understanding that each of us has a circle of caring within which our moral principles apply, outside of which they don't. For example, most people can agree on the principle thou shalt not kill. Yet, almost everybody, there's somebody they would think it's right to kill. For some people, it's the case where a woman hears an intruder in her house, calls her brother who lives next door. He comes out of the house with a gun and shoots and kills the intruder. The intruder turns out to be his own 15-year-old son.
Oops.
Now, it's very interesting, the response to this, that it's viewed as an accident. The question would be, of course, everybody says, oh, it's terrible he killed his own son, but if he killed somebody else's son, then it's okay? So obviously people have a different sort of double standard about people who are inside the circle and outside the circle.
Interesting.
And to me...
That shows you the boundary there. There's a boundary.
And pushing the boundary as far as possible. You know, I think some of the spiritual traditions, many of them, ask us to move that boundary out as far as we can tolerate, and then a little bit more.
Yeah, that's right.
And so for me, people often ask me about these killers. They say, don't they know the difference between right and wrong? And I often say, well, they sometimes have very strong ideas of right and wrong. What they don't do is apply them in a wide range of situations that most of us would consider moral situations. But the point is, neither do we if you push it far enough. So for me, the message sort of is, do everything you can that push and stretch yourself as far as you can to make that circle of caring as wide as possible, where it includes not just your own 15-year-old son breaking into your sister's house, but anybody's 15-year-old son breaking into your sister's house. And boy, that's a transformative way of thinking, and it as far as economic policy and sentencing policy and allocation of resources, it obviously demands a lot of people, because it's not that it's easy to be empathic with dangerous and obnoxious, hostile people, but nobody said that living the good life was supposed to be easy.
Well, on that thought, let me thank you for a stimulating conversation. And
thank you for the opportunity.
All right.